decide whether or not I want to receive an epidural when I'm in labor or if I want to go without medication. So let's talk about the pros and the cons and the side effects of receiving an epidural. So, one of the benefits, and the number one benefit, is that an epidural is the most effective pain relief method that still allows women to be alert and attentive to what's going on, and they can actively participate in their labor. Over 90% of women that have received an epidural report that they have also received significant pain relief throughout their entire labor process. So, because of the location that they put the medicine in the woman, they can use smaller amounts of medication. That location site allows them to do this. There are few side effects with an epidural. But some of the things to note are that at birth, babies are still pretty alert. They breathe well, and overall, they have great muscle tone. So there are some trade-offs. And in order to maintain a mother's safety with an epidural, other interventions must take place. And that includes having her hooked up to an IV to receive fluids, having a bladder catheter because she is unable to control that. There's also continuous blood pressure monitoring, continual contraction monitoring, and continual fetal heart rate monitoring. So you will have some things hooked up to you, and you will be most likely confined to your bed. So there is limited mobility. And because of this, when you birth with an epidural, it's often seen as a medical event instead of a spiritual awakening or something that you are in control of. Other side effects is eating and drinking is restricted. There could be a decrease in the mother's blood pressure. She could experience some itching, nausea. Her labor may be longer. The pushing stage may be longer, and she even may experience a fever. Epidurals can lead to the need for further intervention, such as a need for oxygen, the need for Pitocin in case the labor is taking a long time and we're not seeing any results. So we may need the need for Pitocin. Another side effect is having to use a vacuum or forceps delivery. And then when it comes to baby, there's not many differences, especially when it comes to them breastfeeding. They seem to be alert and have great muscle tone when it's time to breastfeed. The only thing to think about is if mom did experience a fever, which is very rare, then baby could be born with a fever as well, and we'll need to test them for possible infections. There are also some more side effects that are very rare, including nerve damage, toxic drug restrictions, and breathing difficulties for the mom. Something that I often hear is, what about paralysis? So the thing with experiencing paralysis or chronic numbness is this is so rare. And in fact, it's almost nearly non-existent. So it is talked about, but it is very rare. And that's just something to keep in mind. Another thing is the chronic headaches. Only 1% of women experience chronic headaches or severe migraines after birth. So again, it's near to none. The current epidural method focuses on balance between maximizing pain relief while minimizing side effects. So there are pros and there are cons. It's the most effective form of pain relief. However, You're restricted to your bed. You can't move that much. You have all these things hooked up to you that could impact your labor, as well as lead to the need for further interventions, including a possible cesarean. So, something that you should ask yourself when you're weighing the pros and you're weighing the cons and you're deciding, do I get an epidural for my birth? So, we want to ask ourselves what's called brain. So, B, what are the benefits to me, the birthing person, and the benefits to my baby? And then R, what are the risks to me, and what are the possible risks for my baby? A, what are the alternatives? What else could I do? There are different forms of epidural that I could have, or I could have a spinal block, or I could go all natural. What is my intuition as the mother? What is my gut feeling to go with? Trust your intuition because you know above anyone else, above your family, above your provider, you know what's best for you, your body, and your baby. And then lastly, in nothing. What would happen if I do nothing? What would happen if I don't take this step that my provider is recommending? What would happen if I do not receive this intervention? Ask yourself brain when it comes to inductions, including an epidural, and that will help you decide whether or not you want to choose an epidural or if you want to go without pain medication at all for your birth.